Welcome. You're listening to the Keeping Ashland Healthy podcast, a podcast production of the Mental Health and Recovery Board of Ashland County, Ohio. Thanks for joining us. And welcome back to another episode of Keeping Ashland Healthy. And as part of our series with Ashland University, I am joined in studio today by Denise Reed. Welcome, Denise Reed.
Thank you.
Denise, you are, and you'll correct me if I'm wrong, director of the dietetics program over there at Ashland University?
Yes, that is correct.
And clinical assistant professor of dietetics?
Yep.
All right. And I'm excited about this because you are also presenting at the RSVP conference, and you'll talk about some of the similar things that we'll talk about today. But diet has been in the news a lot. It always is, it seems like, but it's been in the news a lot with the new administration. So you are going to sort out all the confusion for us, Denise, and we will know exactly what to do by the end of this podcast. Audience, but if you wouldn't mind, Denise, maybe just introduce a little bit about your education, your background, and how you came to be from Ashland, because in our previous conversation, I'm not sure you graduated from AU, so you may be from another organization. So tell me a little bit about background and just how you ended up in the beautiful county of Ashland.
Yeah, thank you so much, David. Yes, indeed. I am not somebody who had originally graduated from Ashland University, but found my way here. My background, I'm a Buckeye. Went to Ohio State University, got all of my degrees from there. Yeah. But I met a boy from Belleville, Ohio.
Boy from Belleville.
Ended up living in north central Ohio because of that.
That's awesome.
From there, I actually just was going to be a clinical dietitian. And I worked for a number of years in the hospital systems as a clinical nutrition manager, a critical care dietitian, and loved everything about that. But then had the opportunity, as Ashland University was starting up a nutrition and dietetics program, to just start teaching.
So they didn't always have one?
No. That came into fruition with the help of my colleague, David Venata, and he really pushed to get a nutrition and dietetics program at AU. I happen to live in the area, have some graduate degrees, and so he reached out and said, would you like to help teach some classes? I need some help. I'm the only one here. And so I started teaching a class every semester, did that for about 4 years, actually, while I was still working in the hospital systems. And it just eventually morphed into that opportunity of, hey, did you ever think about teaching full-time? And to be quite honest, no, I hadn't thought about ever teaching full-time.
That was not your original career path.
No, I was going to be a clinical dietitian. I love the medical world.
Yeah.
I love everything about nutrition and disease. But it was so fun to teach young students and have them coming up and knowing that we can make an impact by teaching them what they need to know to be successful when they get out there to work as dietitians, that I just made that decision and made the leap and said, yeah, let's do this. I'm coming over to Ashland University. And so I've been here at Ashland University since 2013 full-time, and it's been a great experience.
So going on 13 years.
Mm-hmm.
Wow. And these mostly younger folks that are coming into the program, this fascinates me. What are they like? What are they looking for, these young 18-year-olds, when they come into the program? Where do they want to work? Or, because I know things change. When you're younger, you might have one idea of what things are, and then it changes. As you said yourself, you didn't think you were going to end up being a teacher, but you are. But for these young folks coming into your program, where do they see themselves going, at least initially, when they start with you?
I would say for the majority of our students that come in, they get interested in nutrition because they were athletes. And they realized when they were in high school and they were competing that if they ate certain foods, they felt better, or they felt like they competed better. So many of them come into our program and they're really interested in what we would call sports nutrition and how to feed athletes and what to do. A number of our students are athletes. Yes. I think it's no surprise to anybody from the area that we have a lot of student athletes at Ashland University, and our program is no different. Yeah. And so they come in, and that's what draws them in. I'd say that's what sucks them in. But then once they get into it, they realize there's so many different things they can do in the world of nutrition and dietetics, and they branch out from there. But truly, sports is what often brings them into
Interesting. All right. I did not know that. That is a wonderful summary of that. Now, we did prepare some questions, audience, so that you would get the most out of this time with Denise. You lead the dietetics program at AU and train students who will go on to counsel others, perhaps, about nutrition. But again, what are the most important things you hope your students understand about the relationship between food and long-term health?
We absolutely hope by the time they get done with us at AU that they just have a good understanding and realize what I call the power of food. I think all of us eat, so we all think we know something about nutrition.
Right.
I would tell you professionally that's not true. People don't know everything they need to know about nutrition. And so we hope that our students understand that by simply asking a person to try a new food or to go down a different path with food, that they know that they can change that person's health. They learn that what you eat at every stage of life impacts what happens to you when you're 60, 70, and 80 years old.
Yeah.
For example, like our students, I tell them all the time, make sure you're getting all of your vitamins and your minerals and your calcium and your protein, because right now you're building your bones. At 30, your peak bone mass is hit. And you're not thinking about it if you're not studying nutrition.
Right.
So hoping that they really understand that power and what it brings. And I hope they get to see someday that when they advise a client or a patient with what to eat, they get to see the really phenomenal outcomes.
Yeah.
Because that's what just really brings it home and gets us all excited in the world of nutrition.
Yeah.
When we see someone make a change and their health really does change. I mean, we can save people's lives through good nutrition.
Yeah. Well, in zooming out a little bit and drawing in the focus of the conference this year, I did intentionally incorporate, Bobby Kennedy Jr.'s "Make America Healthy Again" slogan to make Ashland healthy again. And again, audience, I've said this before, but I've never seen it. I've been around a long time, 32 years in the field now, and I've never seen at the federal level, Denise, this kind of a focus on more of a holistic approach, including what we eat and, trying to insist on real food. That is new in my tenure in this profession. So it is something that my board and our agencies, Appleseed Catholic Charities, Acada, our contract partners, and others in this community, we've been embracing for some time. But it's always felt like we were kind of going upstream against people said, "Oh, soda's fine. It's not liquid death, David. It's fine." And we would have events at AU. They would roll out the soda machine. People would love it. And here I am contributing to the early death. So anyway, so the national conversation, it's just changed. Would you agree? Because the pyramid stuff, right? So they flipped that thing. Do you mind weighing in a little bit? It's like, so people are like, what? They flipped it? A solid foundation is not carbs, apparently. It might be more protein-based. But, when things like that happen on the national scene, I'm sure you probably have some opinions about, or you get questions from the students or just on campus in general. People come to you as a dietetics person say, What do you make of this? Should we listen to what is going on here? Is there science behind this? Is there, so can you weigh in a little bit on that without getting you in trouble? I'm not trying to get you in trouble.
Right. No, we'll avoid all political trouble by all means. But no, the things that we are really excited about, as you mentioned, at the national level, we love working in the field of nutrition, that there's this big focus now on natural foods or foods in their natural states.
Yes.
And
foods that look like food.
Yes. They talk all the time about ultra-processed and processed foods. And there's a lot of varying definitions on that without getting too into that. But yes, eating food that's food in its normal state, in its natural state, that hasn't been messed with a lot by us or by the food industry, that we're very excited about to see at the national level. The inverted pyramid, to be honest, for most of us, we've never really cared that much about what the pictures looked like. We just always go with, all right, here's what the government came up with this time, and we're going to just work within those confines, and then we'll go from there. So it was fine to flip the pyramid upside down. The right way pyramid wasn't so great either by any means. But a lot of what they're talking about, we do really love that. I love that they're putting an emphasis on lean proteins.
Yes.
I love that they're talking about, hey, don't buy things that are just sitting on the shelf forever. Like, those are very positive things So we're really excited about that.
And that's one of the things I want to ask you since I had you on. And I know if the audience is anything like me, it's easy to get overwhelmed right now. There's all this attention, but there's all this information coming out on social media or other news platforms. And I know folks get overwhelmed. They're like, David, they throw up their hands. It's like, I don't know. I tell people, I was like, listen, just stay on the outside of the market. Don't go into anything on the inside.
So true.
Stay on the outside. If you go inside, you are going to die. So just shop on the outside. But I mean, but you know what I'm saying? They just want some easy to understand guidance on what they should do.
Yeah.
There's things like Trash Panda. I don't know if you've heard of this. It's like an app.
Yes.
You scan the barcode and it'll tell you will die if you eat this. Or no, it's not that bad, audience. But there's things like that. People are trying to help us all. But I mean, do you have any advice or thoughts on maybe help people to make some sense out of all the information that's coming out now?
Yeah, I would say first and foremost, you always have to consider the source of the information. As I mentioned earlier, because everybody eats, everybody thinks they know nutrition. And so many people that we see online have no education in nutrition. Many of them don't have any degree of any kind, but they're giving advice as if they know how nutrition works in the body. And of course, that's very concerning to us because we see a lot of inaccurate information, things that can harm people, and they're reading about it online. So I think anytime somebody asks us, hey, how can I find good nutrition information? We're always like, first off, look at the source. Who's talking about this? What is their background? Dig into that a little bit. You can find that. They're all happy to share it typically. So look into that so that you can give some credibility or not credibility to what you're seeing.
If there's no licensure, if there's no education, no training, the person says, just trust me.
Yeah. I've been working out for 20 years. Here's what you eat. Well, I don't know that you know what you should be eating, to be quite honest. And so you have to be careful with that. The other thing I would say, though, too, is I know it's very frustrating. We see it in our patients and our clients. They're like, nutrition changes all the time. You're absolutely right. Remember, nutrition is a young science. They didn't discover and name the first vitamin until 1912. And many of the rest of them were discovered later. And I know 1900 seems so long ago, but that's just a little over 100 years ago. In science world, that's like a blink of the eye. So we're still really learning what nutrients are doing. That's why we're always changing our minds, like the egg debate that's been out there forever. Should we eat eggs? Should we not? What's going on? Well, end of the day, we always are like moderation, which is the hardest thing for people to do. But that's really where it sits.
Denise, is it true, one of those things, myths or facts, is it true that everybody's body is different? So it is hard to give like general advice because you and I might both eat a nice hunk of sourdough and slather that thing with organic butter, but maybe our bodies will handle that differently. Is that fair to say that all bodies maybe handle some of the foods differently, or do we all basically do things the same way, or is it more complicated, I guess?
It is absolutely true that we all handle foods in different ways.
Okay.
Of course, we know we can take our best educated guess. We know what human physiology looks like. We can make some assumptions about if you eat this, it's very likely that XYZ is going to happen, whether that's a good thing or a not so favorable thing. But having worked with patients for so many years, especially in the clinical setting, I've definitely learned that what I do with one patient doesn't always work the same way in the next patient. And I think that's just normal medicine. It's the same thing if you're treating, a doctor's prescribing a medication. You give this dose of medication to one patient, it's really effective. You give that same dose to somebody you think is the similar scenario, and it doesn't work. So think of food in a really similar light to like medicine and prescribing.
Yeah, no, I like that because like you said in your intro, you've worked with folks. So you've sat down, I'm sure, with individuals over your career to make these individualized plans. And it is tailored to the individual like these other references you make. I think that's good for the audience to know. Trust me, I get information online too, and you want to believe some of these wild stories, right? Because maybe the messenger seems attractive or persuasive or authoritative. But listen to what Denise is saying here. explore their background,
Yes.
dig a little bit below the surface, audience. Don't just accept what you're being told, because maybe whatever that fad is not really in your best interest.
Anytime it's a fad, it's rare that it's phenomenal.
Yeah. But, there's big money to be made, Denise. Is that fair to say?
Oh, there's huge money in the world of nutrition. And truly, there's not a lot of oversight. It's not like
claims can be made without it going unchallenged.
I mean, there are a few health claims around nutrition that are protected, so to speak, and that there are laws written about, but there's not very many. I mean, even like in supplement world, there's no oversight. Those aren't regulated like medications are, because they're nutrients. So it's considered something that we can get from food. So we're not going to oversee it like we do a medicine, but nutrients can work like medicine. And so there's where it gets kind of challenging. And there's where we get nervous sometimes when people hear some fad and they start taking some supplement or eating one particular food, and that's going to be the do-all, end-all and help them improve their health, but it's not.
Yeah, yeah. This isn't on our list of predetermined questions, so feel free to say no, David. I'm not talking about that. But the GLP-1 thing is that's really starting to take
huge.
off. And I know I just saw the ads for the pill version. Right now, most of them I've seen were injectables, but I know a lot of people don't like needles. And I don't know which one it was, but they're starting to introduce pill versions.
Yep.
And as far as I can tell, Denise, there's not really been any longitudinal studies of some of these things. And it's like that always worries me when there's not longitudinal studies. So, anything might work in the short term, but let's I don't know.
You are exactly right. The GLP-1s have shown some really good success in particular groups of individuals, right? They were first put out there as a form to help with diabetes management, to help with blood sugar control.
Like side effect is they help with weight, right?
That's exactly right. I mean, that's why they then went down that path, because as they were getting put on these GLP-1s to help their blood glucose levels, then we saw them losing weight if they were overweight or obese. And it was like, hey, wait, there's something else going on here. It's not shocking. GLP, without getting crazy, that's actually a hormone that your body produces naturally. We know where it's at. We know what it does. That's why when they prescribed it for diabetes, they knew that it could help with blood glucose control.
Right.
We knew it might be able to help some with weight. I don't think we understood how big those ramifications were going to be. But you are correct, when it comes from the weight management side of it, we don't have a lot of big longitudinal studies.
Right.
The pill 100% does not have big longitudinal studies because it's very new and they got on that really fast as it became popular.
Right.
So time will tell.
Right. Do we have to take this forever? Can you take it forever? Right. If you stop taking it, will you have some rebound? Will you put the weight? I mean, all this stuff. I mean, that goes through my mind. In audience, we've talked about this on other episodes and how this ties into our discussion about mental and emotional health. It's the same with psychiatric medications. I want the audience to just dig into what it says and how those things inform themselves, informed consent. Same thing with all of these things, because as you say, it maybe it's Americans, maybe it's human beings in general, but we tend to want simple, quick solutions to very complex problems. So on the mental health, emotional side, it's like, I'm struggling, I'm not feeling the way I want to feel. Give me something, doc, so that I can feel better. Well, maybe that drug that the doc gives might in some way change your emotions and your mood such that you think that's a benefit, but you haven't really dealt with the underlying issues of your relationship or your job dissatisfaction or you name it, trauma. And similarly, in my mind, Denise, you don't have to agree with me, but when Americans, I was so worried when I heard about this for the first time. I said, no, because Americans are going to say, oh, I don't have to really do that much. I just do this injection. I don't have to really think about my relationship with food. I don't have to think about my activity level. I can just boop. And the next thing I know, I'm dropping weight. And I said, they're not dealing with the underlying issues. So that's what worried me so much.
Not at all. You nailed it on the head. I mean, that's what frightens us tremendously because they're not. And they're not changing what they're doing. And they're not changing their habits. And sure, they're going to lose a little bit of weight. But is it really improving their health?
Yeah.
And the answer is probably no.
Right. It's more than just weight. We understand why being at a good, healthy weight is important, but how you get there is important.
Yes. So important.
Okay. Well, thinking of terms that I have not heard until I would say the last 3 to 4 years. I never heard of these terms so much. And then all of a sudden I couldn't get away from it.
Yeah.
This concept of gut health and the microbiome.
Yeah.
I was like, what?
So
what? That's like, this is like the glory years for dietitians, right? You guys are like, everybody's coming to you saying, what's a microbiome? Why is it important? Do I really need yogurt? So could you, in layman's terms now, Denise, help us understand why gut health and the microbiome and all this discussion has come up all of a sudden?
Yeah, we are. In nutrition world, we're so excited about this, and it just gets our blood pumping.
Okay.
When we think about the microbiome,
You're in the right field, Denise. All right.
I mean, we've always known that we had all these little microorganisms living on our body and in our GI tract. Or, my world, it's the ones in the GI tract that we think about. The thing is that we never really knew what they did. We knew they were there.
Okay.
We knew what happened when they got out of balance. Like I would see that in the hospital and could lead to sepsis and horrible blood infections. So we always knew those things happened. What we didn't understand was that if we have a certain balance of those, let's say, especially we have lots of bacteria in there, if we can control the balance, can that impact our health and our disease? And so in time, eventually, other people got on board with this, but it wasn't until the early 2000s that they put together a whole microbiome project. And when they did that, people way smarter than me, because we're talking about geneticists and microbiologists, but they started to map our microbiome and they started to really study it to see what is that balance like? What are the bugs that live in the mouth and the stomach and the intestines? And how does that impact what goes on in the body? And coming out of that was just profound research. So that's why it's been just recently that you started to hear about, well, if you eat this, it can change your microbiome and then it's going to affect your health this way or another.
I see.
And so I think the future for people in our field and in nutrition, and I tell the students this all the time, I go, I think our future is we're going to teach people how to eat to change the bacteria in their gut to then impact their health. And the thing is that that's starting to play out. I mean, we are already doing some of that. There's some really solid research between the bugs and how they talk to the brain and the lungs and how they impact our health in those ways. And I'm to be transparent, I've already done counseling like that with patients that I've had in hospitals and rehab centers and prescribing things. You're right. You bring up things like yogurt or fermented foods. We've been playing with that
Kimchi
for quite some
me.
time. Yes, with kimchi. And they just recently added some of those things to Convo so that students can have access to it all the time because we've been talking about it on campus. So it is super exciting. It's still such young research, and I know we have so much to learn, but it's just profound what we see coming out.
It's one of those things. That's when you talk about, learning more about it. I would read some of whether it was a pill or something I was eating, it'll say things like, this includes a million different bacteria. I'm like, a million?
Yeah, right.
I was like, well, how many are in? I mean,
millions and millions you have living in there.
I mean, I guess we needed the computers, but how are they mapping all these different little organisms that are in are there really that many?
Oh, yes. I mean, they have identified, it's thousands of different genetic variations of them. And so what we're trying to learn now is, all right, each of those genetic variations, why do they exist?
Yes.
And what does that then mean for us, for our health?
It just seems like the interactive effects, the complexity of that many, like how when I hear what you're saying on one level, if we were talking about like a smaller, like the permutations and how they work together, when you talk about optimizing that balance, I'm like, oh, I get that in theory. But when we're talking about millions of different strains, I'm like, well, that seems like the complexity would be hard to know how they would work together. I don't know. I get overwhelmed when I think about it.
It is a lot. And I think, you know what, though? We'll circle back. I think this is how what we eat affects all of us so differently. And I think that's a big part of why we see some of those differences.
Well, the reason I wanted you on the podcast, and I was pushing when Janelle mentioned your name for our conference, was I'm convinced, I know, as you say, this is young, but I am convinced there's a relationship between gut health and nutrition and mental and emotional health. I just believe that is the case. So I can't, I can't tell you, audience, how excited I am. You need to dig in to Denise and her work more, and just in general, this concept, because there is an absolute relationship, I think, between our gut health, our microbiome,
Right.
and our diets, and then how we're just feeling.
Oh, yes, it's compelling.
Yeah.
I mean, do I think nutrition is going to be the cure-all, end-all to help us with all of our mental health? No. But do I think it's more of a player than what we thought it was before? Yes,
Yep.
I do.
Yep. Well, as we're starting to wrap up, and this is, I could go on and on, audience, but I know you'll tune me out, so I have to draw this conversation to a close. But one practical thing I had on our list here is, how does, speaking of practical, how's practical real world training? Because this question came because I saw the lab that you guys were working in, your nutrition lab.
Yeah.
If folks haven't seen that, it is like a full on professional kitchen. It's like gleaming. So how does that kind of experience, that practical real world training, help the students become more effective nutrition professionals? I just thought that was amazing.
It is a tremendous space. You're absolutely right. And we're very grateful to have such a great space to work in. But it is that side of our, so to speak, curriculum that really helps our students wrap their heads around that power of nutrition that I talked about earlier.
Yeah.
We can only teach them so much when they're sitting in the classroom and we're up front talking or lecturing or whatever they're going to say that we're doing. But when we take them into the lab.
Yeah, what are they doing in there?
Yeah, and we can have them run experiments, learn how to cook healthy foods, figure out, they do need to have some culinary skills. We do work in food service world. Right. So to be able to tie all of that together with what we're talking about in class really helps them to have a good understanding of how nutrients work in the body. Like, for instance, this semester, actually, I'm going there after we get done with this podcast. I have a lab today, and it's in food science class. And we're simply going to be learning about crystallization of sugar by making fudge. Doesn't that sound amazing? But we manipulate that. And when they learn and they can see what happens in that fudge, that helps them understand what happens in the body. And so it's a way for them to see in food and how we cook food and how we prepare food that this is what happens physiologically when we eat food. And it is true.
And how you prepare it, it does make a difference on how much nutritional value. So you can either optimize it or minimize it depending on how it's prepared.
Right. So it's a way for our students to get that hands-on learning. But then I will say, too, the lab is a fantastic space. Our students run so many events for other students on campus, for faculty, for staff, for the community. They come in. We do cooking classes. Right. So that experience is also just phenomenal for our students to get to see what it's really like to be a dietitian before they get those credentials.
That's awesome. Well, we've been speaking with Denise Reed, director of the dietetics program over at Ashland University. And Denise, you are a wonderful guest. This material is just so relevant right now, and you have such a great grasp of it. But I'll tell you, you're such a good speaker. You make some of these complex things, I think, very relatable. So thank you for doing that, because you're cutting through the fog. There's so much information. So audience, if you want to follow up with Denise, you can go to Ashland University. I'll put some information in the show notes today. But thank you so much for your time and helping unpack some of these complex issues.
We love this stuff. So thank you for having me and having the opportunity to talk about this.
All right. See you at the conference.
Thank you.
Thank you for listening to another episode of the Keeping Ashland Healthy podcast. The podcast is a production of the Mental Health and Recovery Board of Ashland County, Ohio. You can reach the board by calling 419-281-3139. Please remember that the board funds a local 24/7 crisis line through Appleseed Community Mental Health Center. It can be reached by calling 419-289-6111. That's 419-289-6111. Until next time, please join us in Keeping Ashland Healthy.